Hello, my name is Mark and I'm a student nurse for today. So today I'm going to be performing oral care on an unconscious patient. Before we do that, I've reviewed the healthcare facility policy to perform the skill, have the doctor's order to perform oral care, and have the knowledge, skill, and judgment to perform the skill. May I come in? Hello, my name is Mark and I'm your student nurse for today. So may I please get your name and your date of birth? Okay. So for today, I'm going to be performing oral care on you. Is that okay? So since the patient is unconscious, we're gonna ask him if he can wiggle his toes. But if he can't, then we'll just take it as a implied consent. Okay? So now we're just gonna raise the height of the bed. And Erica, can you please ensure her privacy? Thank you. Make sure it's up to my working level. I'm just gonna move this.
Sorry.
Okay, make sure it's up to my waist. Okay, good. So now, before we do all of that, we're gonna make sure that the suction works. We're gonna take out the cup with the fluid. Then when we use it, it should be up to 80 and 120 mercury per millimeter. Then we're gonna start it up. And I see that it's working because it's suctioning water out the cup. I'm gonna put this back. So I'm gonna move this closer to me. Okay, so now we're gonna reposition the patient. So we're gonna put pillows on her back. Before we do that, I'm gonna remove the pillow off her head. Okay, make sure you hold her head, please, before you get the draw sheet. Please place the draw sheet here. So I'll hold her head, okay? As you fix the draw sheet. Okay. Is that okay? So on the count of 3, we're gonna turn her towards me. 1, 2, 3. Then, on the count of 3, we're gonna flip her towards you. 1, 2, 3. Can you hold her head, please? Thank you. I'm gonna put her down gently. Okay. Place your feet back to normal. You shouldn't expose her. Okay. That's good. So now, we're gonna put her in an extreme lateral position. So, but first, before we do that, we're gonna move her towards the edge of the bed, towards Erica. So, on the count of 3, 1, 2, 3. Then now, we're gonna turn her facing me on the right hand side. So, count of 3, 1, 2, 3. Make sure you place all the pillows on the back, on her knees. Does she need one more pillow? Okay, she's fine. So now we're just gonna raise the head of the bed to at least 15 to 30 degrees. You should ensure her safety as well. And make sure that her chin is pointing downwards towards the foot of the bed. Okay, so just gonna move the pillow so that she's comfortable. Okay, so now before we do all the oral care and stuff, we're gonna hand hygiene first, and we're gonna don our gloves as well. So after we don our gloves, we're gonna gather all the materials. First, I want to start off with the blue pad, and the kidney basin, and the towel. Use the kidney, the blue pad under here. And after the kidney basin, and also the towel, so we can wipe the patient after we wash them. Okay, so now we're gonna gather the tongue depressor to assess for gag reflex. But before we do that, we're just gonna suction out her mouth for any excess fluid. Okay. So now that's all done, you can now assess for gag reflex or any abnormalities in her mouth. So I see that there is no swelling, no bleeding, her teeth's okay, and that there's no redness in the mouth. After that, we're just gonna dump it over here, pretend that's our garbage. Then now we can start the oral care, the 5 pipettes. So first, we have 5 pipettes for each quadrant of the mouth, and also the roof and the base of the mouth. So we're just gonna dump it in water and wring out any excess fluid. And first, we're gonna start off with the left upper quadrant, brush the front, and brush the back. And then we're gonna just dump that out. And then we're gonna do it the same for the right quadrant. Wring out any excess fluid. Upper front, right upper quadrant, and the back. So since we can see the bottom tooth, we're just gonna use the denture over here as an example. So for the right lower quadrant, brush the front, brush the back, dump it out. And then here, dump it in water. Left lower quadrant, front, and the back. Dump it out, get this back. And now we're gonna brush the tongue and the hard palate inside the patient's mouth. Get the tooth and the hard palate. Okay, now that's done. We're gonna section out the patient's mouth for any excess fluid. Now we're all set and done. We're gonna assess her mouth again for any abnormalities. As I see that there's no abnormalities in the mouth, no swelling, no bleeding, no redness whatsoever. She's okay, she's now good to go. After that, we're gonna just wipe her mouth after we brush her. And we can put this here. Then we're gonna remove all the materials. Kidney paste and the blue pad, but place them over here to the side, and also these. And now we're just gonna doff our gloves. Make sure that we're not touching the hand, and doff it inside over here. Throw in the garbage. So now we're just gonna put the patient back to normal position. Lower the head of the head. Please, can you remove all her pillows? Thank you. Thank you. And then remove the heel of the head as well. I'm gonna put her back down gently. There you go. And now we're just gonna move her towards the middle of the bed. So the count of 3. 1, 2, 3. Slip and slide. Okay. Back to. Actually, we're gonna remove the draw sheet first. So we're gonna turn her towards me. Count of 3. 1, 2, 3. Okay. Flip her towards Erica's side. And then flip her towards you again so you can get it out. Count of 3. 1, 2, 3. Thank you. Put her back down slowly. And then place the pillow back on her head. So make sure we're gonna ensure her safety by putting all the railings up. Thank you. And then now we're gonna lower the height of the bed. Now she's good to go. She can just call the bell if anything. And yeah, that concludes oral care on an unconscious patient.